when we got the data back and took a look at it, I'd actually been working in education, looking at a number of different education programs, and what we found was, some things that we thought would work actually had pretty modest impacts, or we couldn't even see an impact at all. And this was something that, as soon as we got the data, we saw this tremendous impact on children being able to stay at school. And school, being absent from school, either because you're absent on a particular day or because you dropped out, that actually fell by around a quarter. And since the program's so inexpensive, it was looking very cost effective as a way to keep kids in school. Now, that was the initial result that we saw. But then as we looked at the data more closely, we realized it wasn't just the children who were dewormed themselves who benefited, but other children in the same school and even in nearby schools also had lower worm loads and better educational outcomes, presumably because the mass treatment decreased disease transmission. If you can break that cycle of disease transmission or slow that cycle of disease transmission, that can have very big public health effects. I hadn't thought of it, but this is the same sort of thing now that we're seeing with COVID-19, that if we can bring down, if people use masks or if people get vaccinated, that not only protects themselves, but it has an effect on the larger community. And
I'll just build on what Michael said. The broader benefits for the community have now been documented in several different ways. In the initial work, we show that the children who did not receive deworming treatment within the schools that got mass treatment, they showed large reductions in infection and some gains in schooling. We showed that kids who live within about 4 kilometers of the treatment schools, their worm infection rates went down. And then there's been subsequent work in this area by a former student of mine and Michael's, Owen Osier, who showed that even kids who were younger in these areas at the time, so they weren't even in primary school age, they also show health and nutrition gains from living in an area where there was mass drug administration for deworming. Because even these younger kids get worm infections. They have bad hygiene, they get infected. And when you mass treat the primary school age kids, you're improving the disease environment even for the younger kids. So when Owen Osier followed these kids up 10 years later, they had grown more, they had done better in school, et cetera, because of this program. So the broader benefits are substantial.
What Evidence Action did, as we saw this phenomenal research coming out, all of this promise, we then asked ourselves, how do we effectively work with governments to scale it up? This is a treatment, but it's a treatment where the benefits may be difficult to see. It requires tremendous logistical operations to actually set up these mass drug administrations. And so our focus was really on working with partnerships with governments to help them scale. And so looking at the research and asking ourselves, how do we go from a situation where a very small proportion of the 1 billion children who need deworming treatment are receiving it, to one where a large proportion of them are? And so we've partnered with governments across India, Nigeria, Kenya, Pakistan, to help them reach hundreds of millions of children annually. So again, as we think about this question of the evidence to policy pipeline, I think deworming is just this really interesting case study where the evidence that Michael and Ted created had just served as this immense impetus for governments, for ourselves, for others to really take this to large scale.
We just published a paper in Proceedings of National Academy of Sciences where we looked at the impact 20 years later. And it's pretty unusual that one is able to follow up. But that was it was really a huge amount of work, which Ted really led on trying to see what this impact was, and the results are really striking. And and it turns out that these impacts are very persistent. So we found that children who received deworming in schools for an extra 2 or 3 years, because eventually the program was phased in elsewhere, they earned 13% more 20 years later. So if you think about this, this is something that where the medicine itself costs only a few cents. The program overall costs less than $1 per child per year. So if people are earning that much more 20 years later, if you think about this purely as an investment, if you thought about, if you're thinking about putting your money in a bank account, I don't know, you earn a couple percent interest. Put your money in the stock market, you earn a 7%, 8% over the long term. When we're very conservative about this, the annual rate of return is 37%. So this is just a phenomenal investment. Even if you look at it very narrowly, you're sort of a cold-hearted, we're economists, so imagine you didn't think about any of the health gains or anything like that. The value of this just as an investment, it's phenomenal. Now, I guess if you put your money in the bank account, the money comes back to you. This is a return to society as a whole. But this makes sense for governments to invest in. It makes sense for philanthropists to invest in.
The kids who receive deworming when they were kids, when they grow up, their life is different in many ways. Michael just mentioned that their earnings go up, their food consumption goes up, their living standards go up, measured several different ways. Other aspects of their life change. The folks who got deworming when they were kids are actually significantly more likely to move to cities like Nairobi, where again, life is very different. So, for some individuals, this was very, very transformative. One more finding that I want to mention really speaks to the next wave of research that we plan to do. As Michael mentioned, we've been following this sample for a long time. We've been following them now for over 20 years. We're hoping to continue into the future. And a lot of our research attention now is shifting towards not just studying the initial recipients of deworming, but also understanding what happens to the next generation. And could it be the case that receiving this health investment when you're a child affects your own children and their outcomes when you're an adult? And this analysis is still ongoing, but the initial analysis to date indicates that the children of the individuals who received more deworming are themselves healthier. And again, this is 20-something years later, speaking to the potential for important and intergenerational impacts and the possibility that investing in child health could contribute to breaking the cycle of poverty in Kenya and other settings where worm infections are widespread.
The ability of governments to do this with some assistance is just enormous. We've worked with, for example, the Indian government. We're in 11 states in India, and we support them in doing a National Deworming Day. Not only has the government taken this up, but they're actually funding a majority of the costs at this point, and it's reaching hundreds of millions of children. That means that an entire generation of Indian children will actually be healthier, more productive. Based on some of this upcoming research, it sounds like their children will be more healthy, more productive. And so that's just this really profound impact. And in terms of the support that the governments need, the intervention is both simultaneously very simple and yet complicated. So it's very simple and then it's delivered via schools. And what that allows is just enormous scalability. If a child is in school, you are able to reach them. And it only takes, we either do rounds every year or twice a year, depending on the prevalence. And so it's a massive undertaking to actually do the deworming in any given day, as you can imagine in a country like India, but it's then done, right? It doesn't require many follow-ups. So in that sense, it can be quite easy. At the same time, there is quite a bit of logistics. There's the purchasing of the drugs, the forecasting of the drugs, the planning of the campaign, the educating of the teachers, et cetera. Planning for the budget. And so that's really where our work with governments comes to the fore, is helping them do that planning, helping them do that prioritization, et cetera. But I think we've been incredibly heartened to see what a large proportion of the worm burden that the governments we partner with are able to address.
One of the things we've been doing in recent work, I mentioned we've been looking at the children of the folks who receive deworming drugs, but we're also looking at their broader family relationships. And one of the things that we're able to do is measure the kind of support that the individuals in our sample are able to provide for their elderly relatives, typically their parents, but even sometimes their grandparents. We measure how much they send to them in terms of money or gifts and sort of provide support for them. So one of the things that we're finding, which is also one of these broader benefits of the program, is the individuals who received more deworming as children, who we found are earning more and have sort of better livelihoods themselves. They also send significantly more money as gifts and cash transfers to their elderly relatives. So it's another form of spillover that the whole family unit is benefiting from the increased productivity, economic productivity, and earnings of the kids who receive deworming.